Good afternoon, Pueblo. This is Akemi Trujillo, your public health planner at the Pueblo Department of Public Health and Environment. The 2024 Joint Community Health Assessment wrapped up at the end of July, and I'm here to share some of the highlights resulting from that collaborative process. So first things first, what is a community health assessment, or what we call a CHA? The state-mandated process that local public health agencies have to complete every 5 years. The process includes collecting tons of data and information to determine where the biggest health issues and priorities lie in the community. The CHA then feeds into the CHIP, or the Community Health Improvement Plan. And that is where implementation of improvement strategies occurs with diverse stakeholders to work on improving those health priorities identified in the CHA. The last time that we completed a health department CHA was in 2021, which was in the midst of the COVID pandemic. And it looked very different from the joint CHA that we just completed. And that's because for the first time ever, PDPHE was joined by 4 other health systems in the community to complete a single health assessment and work jointly. And so those partners were UC Health Parkview Medical Center, Common Spirit St. Mary Corwin Hospital, Health Solutions, and Pueblo Community Health Center. Colorado State University Pueblo, or CSUP, also played an enormous role in the project, offering professor and intern expertise and capacity throughout the process. So in addition to those partnerships, the health department also committed to jumping on that partner timeline to complete a CHA every 3 years moving forward. Conversations around the joint CHA really started way back in September of 2023, which kicked off our planning session. And then in January of 2024, implementation started with the process of collecting secondary data, which is the data that's already available state, federally, or through foundations, as well as primary data, which is the data that we went out and collected and heard from the community. This ran through the end of April, where then May and June were dedicated to data analysis. And then July, we finalized the priorities and we're ready to communicate the results.
Hi, Olivia Leyva here. I'm the Equity and Engagement Initiatives Coordinator at the Pueblo Department of Public Health and Environment. I'm here to talk specifically about our primary data collection efforts. So overall, these efforts for the CHA were very successful. And truly, we focused on outreach to specific target populations in Pueblo County. These populations included our aging population, so adults above the age of 65, our Spanish-speaking population, individuals experiencing unstable housing, as well as individuals living with disabilities. We know that these folks have been historically underrepresented in data collection efforts, so we made the intentional effort to outreach to them. Overall, in the end, we saw 510 community partners and members participating in our data collection efforts. And this was done through a series of surveys, but also focus groups with specific populations. The demographics from the CHA survey overall were very representative of Pueblo County demographics, whether that be the geography folks were coming from, whether that be race or ethnicity, and also age. We did see that folks that identified as female in our survey took the survey more often than folks who identified as males. So we are going to be doing some weighing process on the back end with our data collection efforts to really make sure that we're representative there.
So you waited this long. So what are the top 2 health priorities determined by all the joint CHA partners? Top health priorities came out to be mental health and risky behaviors, which does include substance use. Data told us that young people, specifically high school students, are living with extreme mental health needs and challenges, and that aligns with the overarching need for more mental health services across the state. And additionally, when asked what the top health concerns were for themselves, as well as those that they cared about, the top needs were anxiety, stress, bullying, exposure to violence, and loneliness. The second priority is risky behaviors, which can include anything from substance use to choices like wearing a seatbelt in the car or engaging in risky sexual behaviors. The data that we collected from external sources visualized that Pueblo has a lot to improve on when it came to adult cigarette use, youth vaping, and marijuana usage, and youth that felt safe at school. The data that we collected from the community told us that overall, most of the respondents understood what was risky or highly risky behavior, Now that we know what to work on, our health systems need to determine how we're going to work on it. So from August to December of 2024, partners will focus on creating the new 2025 to 2028 Community Health Improvement Plan, or CHIP. The plan outlines the strategies and the gaps in services or resources that need some extra intentional effort. The new CHIP will then start in January of 2025, which will feature ongoing pulse checks and communication out to the community on updates and progress. So to learn more about our joint CHA progress and results, or to stay up to date on the progress on our new joint CHIP, please visit pueblohealth.org, go to the A to Z directory, and click on Community Health Assessment. Thank you so much for your commitment to ensuring a thriving, safe, and healthy Pueblo County.